I'm happy to report here that I have 0% of seroma.
Amazing.
In my entire practice. Bleeding can be there because after all it's an invasive procedure, and we use certain solutions to not have bleeding during the procedure. Sometimes in a hypertensive patient, in a male patient, in people who have lost large amounts of weight, they have a tendency to bleed. So you may have hematoma in one area or the other. Usually that resolves by itself. We don't have to open or do anything most of the cases. You can have infection, and this is an important point. Liposuction, especially bigger ones, or any liposuction, must be done with all sterile precautions. It's a surgical procedure. It's not something to be done on a kitchen counter.
Very true.
So full sterile precautions, proper draping. If you follow all those precautions and maybe one dose of antibiotic to cover during the procedure, infection rates are very low. But it can happen, and it can be traced to a source of infection either in the patient's own skin. So that means the patients should not have liposuction if they have any other source of infection on their body. If they are running some infection, sinusitis, sore throat, let's say there are skin boils, let's say there is gynecological infection, any urinary infection, that is not a period to do this procedure because the bacteria can jump from one area to the other and can. So seroma, infection, bleeding, later on there can be irregularities. So again, the smoothness of the result depends on the surgeon, how well he's making the whole area smooth. But despite the best surgery, you can still have irregularities in the way the skin shrinks.